Good evening, everyone, and welcome to today's session. Good to see a good number of you. I had been a little late today, almost half an hour late, but sometimes it is inevitable. We are delayed, but let's make sure that every day we are learning together, we are preparing together. So there are a lot of videos available, there are a lot of material available. The most interesting part of the entrance preparation is to have a classmate who can be able to sit with you, juggle the concepts, and make the entire journey of preparation more interesting. That is where you will have Dr. Murali Bharadwaz every day evening, Chai Pe Charcha for the NEET PG preparation. So let's make the great beginning, Doctor. You're all quite aware that we have started a trend called flashcards in psychiatry. Let us work on this. There are 1,500 concepts in the entire psychiatry needed for the entrance examination. Hardly it doesn't take more than 10 to 12 hours to play with these 1,500 concepts. So that is the whole idea behind starting up this Chai Pe Charcha session every day evening, sometime at 6 o'clock, sometime at 8 o'clock, etc. So thanks for patiently waiting, though I'm little delayed. Let's make the great beginning. Can the online students can punch whether the voice is loud and clear for all of you? Now, what are the various sections in mental status examination of the higher mental functions? Mood, affect, speech, language, cognition, these are all tested in the mental status examination. Now, a 25-year-old woman complains of intensely depressed mood for the last 6 months. She also reports inability to enjoy the previously pleasurable activities. What is this symptom called as? It is called anhedonia. Anhedonia is the definition which you should not forget. Good to see Dhanalakshmi, Sanjay, and many more who are all online. Thanks for joining. The inability to recognize and to describe the feelings. What do you call it as? We call it as alexithymia. So you should be very sure. Definitions are very important for the examiner. A person who laughs at 1 minute and cries in the next minute without any clear stimulus. What is he having? He is having a labile affect. The affect is something like a mood. So he is having a labile affect. So if you look at the people who have pseudobulbar palsy, where do you find pseudobulbar palsy, doctor? For example, in motor neuron disease, they have a labile affect is what you need to remember. Phantom limb. It is an example of what? Keep punching your answers, doctor. See, flashcards is such a beautiful concept. कार्ड की एक तरफ आपको क्वेश्चन रहता, उसको मारे तो आंसर दिखता. सो उसको मारने के पहले आप सोच रहे हैं कि मुझे आता है या नहीं आता है. ये तो कंप्लीट अजीब बात है क्या बोल के सोचना. And you have a choice to label that am I sure about this card or am I not sure about. And at the end of it, it will bookmark all those cards, flashcards, which you are not sure about. So that in the last moment before exam, you can always do a quick revision of those flashcards which you are not sure about. Good to see Swati and many more who are online. So phantom limb is an example of a disorder of perception. A patient wanting to scratch for itching in his amputated limb, the area where his limb was there, which was removed, but in that area में itching के जैसे feeling आ रहा है. इसको क्या बोलते हैं? So you should know phantom limb hallucination, how does it look like, etc., etc. A 8-year-old child after tonsillectomy sees a bear in her room. She screams in the fright. A nurse who rushes and on switching on the light finds a rug wrapped on an armchair. So what is this where a rug on the armchair has been mistaken for the bear? The stimulus is there, but it got misinterpreted. What do you like to call this as? This is an illusion, is what you need to remember. So about hallucinations, you should know that hallucinations are as vivid, as clear in explanation as the real perception. But hallucinations occur in the outer, not inner, subjective space. अगर अंदर अंदर हो रहा तो उसको hallucination नहीं बोलते. Bahar, outer subjective space. It occurs in the absence of any perceptual stimulus. There is no stimulus. And it is independent of the will of the observer. So these are the 4 characteristic features of the hallucinations. You should not forget, one of the favorite questions of the examiner. Formed visual hallucinations. Where do you see? They are seen in lesion of which cerebral lobe? Formed visual hallucinations. Come on, keep guessing, keep punching your answers, doctor. Let's make this session more interesting. Temporal lobe lesions, you get formed visual hallucinations. Organic cause of the behavioral symptoms. A lot of times, it is important to differentiate from the functional disorders from the real disorders. So what is suggestive that there is an organic cause for the behavioral symptoms? If there are prominent visual hallucinations, they are suggestive of an organic cause of the behavioral symptoms, is what you need to remember. When do you experience hypnopompic phenomena? Is an important question. Typically, whenever a hallucination is happening, at the end of the sleep, when the person is getting up from the sleep, isko bolte hain hypnopompic hallucination, is what you should remember. Hallucinations which happen at the start of the sleep, what do you call them as? Good to see Neha Narang, Suhani Pathak, and many more who are all online. Very good. मैंने 8 बजे को शुरू करूंगा बोल के सोचा, जरा एक आधा घंटा लेट हो गया, हुजूर माफ करना. So, right. So, but every day we are going to have a live class. So, let me once more tell all of you guys that there are so many videos in the mobile apps. Even on our online mbbs.com, there is a video library of around 427 hours of video lectures. We released the 2022 edition. 427 hours of video lectures, totally around 1560 video lectures, running around 427 hours, all HD videos. There may be videos, there are wonderfully written books, but what you need is एक साथी के साथ बैठ के आमने सामने डिस्कशन होना है. That is how anyone will win the entrance exam. So that is the reason we started a new concept. Shortly, you are going to have this on the Incus learning app called Flashcards. Flashcard में एक point रहता है आपके साथी के साथ बैठो, पूछो उनको, भाई ये इसका आंसर क्या है बोलो। वो बोलेगा, टिंग मारो, वो टर्न हो जाएगा और आपको दिखाएगा. If you are confident on that point, you label that I am very sure about it. Then you go to the next question. So those points which you are not sure all become bookmarked. Last moment before exam, you can be able to revise all those bookmarked things. So preparation is very easy. बहुत कॉस्टली कोचिंग प्रोग्राम्स का जरूरत भी नहीं है. Incus लर्निंग ऐप के ऊपर फ्लैश कार्ड्स. There are 1500 flashcards in the form of concepts in psychiatry. So take every opportunity. Once another 4-5 days where we are launching the new version of the Incus learning app, I will update all of you. So doctor, and every day evening, we will take opportunity to do the revision of these flashcards. Very good. Neha gives a very good trick. Hypnagogic. Sleep goes. Gogic, go. Go, bole to jao. Gogic, jao. Very good. So that's how by coming to our YouTube channel every day evening, you will get good friends like Neha who will help you to become better in preparation. Good. Hallucinations which occur at the start of the sleep are hypnagogic. Hypnagogic. Sleep goes, right. Where do you see hallucinations? Schizophrenia, any seizures due to intracerebral space occupying lesions, LSD intoxication, at least 2-3 causes. लिस्ट वाला चीजें आप बट्टी मारना पड़ता है, आपको फ्लैश कार्ड में मिल जाएगा सब कुछ. Olfactory hallucinations, where do you see? Come on, who will tell? Neha, Suhani, Swati, Dhana, come on. So that's how you should play. Can I remember 4 causes? Schizophrenia, Alzheimer's disease, medial temporal sclerosis, temporal lobe epilepsy. 4 causes for olfactory hallucinations. Very good. Good to see Devi Priya. So, some rubber tire is burning, Dr. Saab. कुछ जल रहा है, Dr. Saab. ये सब बोलते हैं ना, olfactory hallucinations. Visual hallucinations. What type of schizophrenia do you see? One of the favorite questions in the PGI Chandigarh exam. So, punch will answer, doctor. What type of schizophrenia? Hebephrenic schizophrenia में visual hallucinations मिलेगा. अच्छा भैया, hebephrenic क्यों बोलते हैं इसको? It has got a very poor prognosis. Hebephrenic, according to the Latin Greek, जहां से a word शुरू हुआ, hebephrenic होता है एडोलेसेंस में, टीनेज में शुरू होने वाला hallucination को बोलते हैं hebephrenic hallucination. Is what you need to remember, because it is a very early onset. Hebephrenic schizophrenia बोलते हैं because a very early onset schizophrenia, it has got a poor prognosis, is what you have to remember. Visual hallucinations. Where do you see? Where do you see visual hallucinations? We see it both in delirium. Delirium में भी patient बोलता है, डॉक्टर मुझे सांप दिख रहा है, यमधर्मराज दिख रहा है, right? Scorpions दिख रहे हैं डॉक्टर मुझे. So delirium, temporal lobe epilepsy also, visual hallucinations. Reflex hallucination is a morbid variety of synesthesia. अच्छा भैया, synesthesia क्या होता है? A sensory stimulus in one modality will result in sensory experience in other. एक गाना सुन लिए तो लड्डू खाने का फीलिंग आ गया. गाना होता है म्यूजिक, लड्डू खाना होता है टेस्ट. So Generally, this kind of reflex hallucinations don't have any medical significance, is what you need to remember. Cognition. What is cognition? Cognition होता है, the term cognition is basically about how you learn the various sensory modalities is called cognition. So the cognition is used to imply about the thought is what you need to remember. Now, if a person is having a thought, repetition of the thought, but the thought is completely out of context, what is it called? It's called perseveration. Perseveration is the out of the context repetition of the thought is called as perseveration, is what you need to remember. If somebody is over including irrelevant details while eventually getting back to the original point, हम हिंदी में बोलते ना, इधर उधर घूम के चक्कर मारना बंद करके सीधा बताओ क्या चाहिए आपको. So inclusion of irrelevant details while eventually getting back to the original point. What is it called? Circumstantiality. It is the over inclusion of irrelevant details while eventually getting back to the original point. Senseless repetition of words. What is it called? It's called verbigeration, is the term for senseless repetition. Skirting around the end point but never reaching the end point. What is it called as? It is called verbiridden, is the term given for skirting around the end point but not reaching to it. अरे भाई तू ये सब क्यों बोलते हो? पॉइंट को आओ ना बोल के बोलते हैं लोग. पॉइंट को आओ ना, इधर उधर चक्कर मारो मत, मुझे समझ में नहीं आ रहे, पॉइंट क्या है बोलो बोलते. इसको बोलते हैं verbiridden. Verbiridden is the skirting around the end point but never reaching. It is called verbiridden. Persistent and inappropriate repetition of the same thought. वही बैठे तो आपका सोच, जागे तो आपका सोच, नींद में भी आपका विचार हो रहा है कोई बोले तो इसका मतलब क्या होता है? It's called perseveration. It's a persistent, inappropriate repetition of the same thought is what you need to remember. Shalmali is asking, sir, what is the difference between verbiridden and tangentiality? Verbiridden is striking around the end point but never reaching it. Yesterday discussion we discussed about tangentiality, definition of tangentiality. You need to watch both the videos and tell me the difference that you felt. Shalmali. In schizophrenia, what is the characteristic feature of schizophrenia? Schizophrenia is a formal thought disorder, is what you have to emphatically remember. Loosening of association. Yesterday I told the difference between derailment and loosening of association. Somebody asked a question, right? So loosening of association is an example of a formal thought disorder. Just like schizophrenia is a formal thought disorder, which is not a disorder of form of thought. Derailment, tangentiality, loosening of association, they're all the disorders of the form of the thought. Thought में organization होता है, form होता है. So yesterday I discussed with you the different thought disorders of thought in yesterday's video. So please take every opportunity to do that revision. Which is a thought disorder out of all this? So you should remember circumstantiality, tangentiality, prolixity, they're all thought disorders. अच्छा भाई, प्रोलिक्सिटी क्या होता है? मेडिकल कॉलेज में हमारा प्रोफेसर प्रोलिक्सिटी ज्यादा होता है. प्रोलिक्सिटी बोले तो इफ समवन लाइक्स टू टॉक बट दे आर रियली बोरिंग, they have got prolixity. It is not something to be proud of. Prolixity means about the same thing as long-windedness. वो बोलते ही माइक दे दिया तो मार के छोड़ेगा. हम भाग के आके बोलना पड़ेगा कि भाई काफी भाषण दिया, माइक दे दो बाबा प्लीज. सो इसको बोलते हैं प्रोलिक्सिटी. प्रोलिक्सिटी इज ऑल्सो ए थॉट डिसऑर्डर. Delusion, what is it? A disorder of what? It is a disorder of perception. Perception. Delusion is a disorder of perception. Now, a false belief which is unexplained by reality but shared by number of people. भारत में बहुत होता है. Superstition. Why are you superstitious बोलते हैं? Now, what are primary delusions? Primary delusions are disorder of what? They are not the disorder of the flow, the form, the position, but they are the disorders of content of the thought. Yesterday के हमारे चाय पे चर्चा पे हमने डिस्कशन किया different disorders of thought. Flow of thought, form of thought, content of thought, position of thought. Please take every chance to do a revision of that. Now, tell me 3 disorders where the delusions are seen. Three disorders where delusions are seen. So this is the beautiness of flashcards. अगर आप 6th क्लास, 8th क्लास, 10th क्लास में हो या मेडिसिन फाइनल ईयर में हो, flashcards are always beautiful concept of doing a revision before exam. So please look forward on the Incus app. We are going to introduce the concept of flashcards for revision. Okay? Now, 3 disorders where delusions are seen, or rather 4 disorders. Dementia में delusions होता है, depression में, schizophrenia में, mania में, you have the delusions. Tell me 4 conditions where delusion of persecution are seen. Schizophrenia, delusional disorder, maniac episode, melancholic depression. ये सारे चीजों में कोई मेरे ऊपर जासूसी कर रहा है. Somebody is spying on me. That's called delusion of persecution. Tell me 2 conditions where delusion of grandiosity can be seen. Paranoid schizophrenia and schizo. Delusion is a perceptual disorder, no doubt. Let me recheck that and come back. Somebody can quickly do a Google search. Delusion is a disorder of thought or disorder of perception? फटाफट बताओ. Google क्या बोलेगा? Dr. Google. So now, tell me 2 conditions where delusion of grandiosity is seen. Paranoid schizophrenia and schizoaffective disorder. So schizoaffective disorder, people are very fundamentally very secretive in nature. And there is also another thing called schizoid personality, where they are not open for meeting others, etc. So paranoid schizophrenia, schizoaffective disorder, delusion of the grandiosity can be seen. 3 conditions where nihilistic ideas are seen. Paranoid schizophrenia, nihilistic delusion क्या होता है? Nihilistic delusion means world is going to end. There is not going to be any NEET PG. COVID is responsible for Kali Yuga का अंत आ रहा है. That is called nihilistic delusion. Depression, Cotard syndrome, paranoid schizophrenia, you find nihilistic ideas. 22-year-old student had a fight with a neighboring boy. On the next day, while he was out, he started feeling that there are two men in police uniform who are observing his movements. When he reached home in the evening, he was frightened and told the family members, "Oh my God, police are behind me, they're going to arrest me." पहला फाइटिंग कैकू करना, करने के बाद क्यों डरना, डरने के बाद क्यों मरना? So, despite reassurance by the family members, he remained afraid that he is about to get arrested. So, what kind of symptom you call it as? It's called delusion of persecution. So, before we understand psychosis, psychiatry, what is a correct, healthy thinking? Continuity, constancy, organization defines healthy thinking. Very important. Now, whenever you are doing mental status examination, the person's awareness regarding the disease, what do you call it as? Insight. Patient ko insight hai ya nahi? That is very important, right? So, impaired insight. Patient is worried that he is having some andar se cancer hai, मैं मर रहा हूं. खाली बोल रहे हैं या सचमुच उसको मालूम है कि ये पूरा नौटंकी कर रहा है बोल के उसको मालूम है या नहीं? That is insight. So impaired insight is, एक साइकोटिक को मालूम नहीं कि वो साइकोटिक के जैसे बिहेव कर रहे हैं. एक शिजोफ्रेनिया का मालूम नहीं है कि वो पागल के जैसे बिहेव कर रहा है. So absence of the insight, impaired insight, is a feature which is found in acute psychosis and schizophrenia. That completes our first topic, all definitions in psychiatry. Flashcards में एक चैप्टर को बोलते हैं डेक. डेक में 150-200 questions रहता है. Every question is called a flashcard. Okay, so now comes schizophrenia. Let me check how good you are in schizophrenia. Who classified the psychiatric illness into two clinical types? Dementia precox and mania depressive illness. Who is going to punch the name? Kaun banega PG Pati? Okay, Neha reconfirms, sir, it is a disorder. Delusion is a disorder of thought, not perception. Very good, very good. Nice correction. So that is the reason you should remember, kabhi there can be a word of error of commission or error of omission. So that keeps you alert, at least, to have the corrections, right? So good. Thank you, Neha, for rightly correcting that it is not a disorder of perception, but a disorder of thought. Very good. So who is going to give me the correct answer? Kraepelin classified psychiatric illness into dementia precox and mania and depression. Why Kraepelin used the word dementia precox for the schizophrenia? Typically, dementia precox is characterized by chronic and a deteriorating course, along with a gradual decline of cognitive function like the memory, attention, goal director behavior and all that. Similar to dementia. So that is the reason Kraepelin has observed the schizophrenics and found that their cognitive function is slowly declining, इसलिए उसका नाम दिया dementia precox. So the other thing that Kraepelin observed was maniac depressive illness. But the main difference between dementia precox, very good, Swati. You are all awake, alert while attending this session by reconfirming that it is a disorder of the thought, delusion. Good. Cognitive decline is a feature of only the dementia precox, not the maniac depressive illness. So who coined the term schizophrenia? Who is this great man? So you should remember Eugen Bleuler is the one who coined the term schizophrenia. Bleuler के भाषा में there are 4 A's of Bleuler. The guy who used the word schizophrenia. What are the 4 A's of Bleuler? A, autistic thinking and behavior, otherwise called autism. A is ambivalence. A is affective disorders. A is the association disturbances. So marked inability to take a decision, complete indecision, इसको क्या बोलते हैं? Which A out of these 4? इसको बोलते हैं ambivalence. Ambivalence is inability to take a decision. Is called as ambivalence. Excessive fantasy thinking, which is irrational and withdrawn behavior. What is the term for that? Among the Bleuler's A's, autistic thinking and behavior. Autism में excessive fantasy thinking, which is irrational, and a withdrawn behavior. That is autistic behavior. Among the Bleuler's A's. So what are the Bleuler's A's? Autism, ambivalence, affect, association. In सारी चीजों में, which is a formal thought disorder, association disturbances. There is a disturbance of the association of the thoughts. Is a formal thought disorder. Now, what are 11 Schneiderian first rank symptoms in schizophrenia? So there are 11 Schneiderian first rank symptoms. There are 3 thought phenomena. There are 3 made phenomena, 3 auditory hallucinations, somatic passivity, delusional perception. ये सब चीजों को कहते हैं Schneiderian's first rank symptoms. Is what you need to remember. Okay? 3 types of thought phenomena adopted, 3 types of made phenomena, 3 types of auditory hallucinations, somatic passivity, delusional perception. These are the 11 Schneiderian first rank symptoms, is what you need to remember. Now the question comes, by a first rank symptoms of Schneiderian, Schneider ने first rank symptoms discover किया. Are they found only in schizophrenia? Are they pathognomonic of schizophrenia? No, sir. They are frequently seen in schizophrenia, characteristic of the illness, but they can also be there in other illnesses. That's the reason they are not pathognomonic of schizophrenia, is what you need to remember. So Dr. Pooja, you require a small correction. Schneiderian first rank symptoms, they are not pathognomonic. They are characteristic, frequently seen, or sub barabar, but they are not pathognomonic. So what are the three thought phenomena among the Schneiderian first rank symptoms? Very interesting question. So you should remember thought insertion, thought withdrawal, thought broadcast. Very good, Dr. Krishna Mohan. I have one radiology Krishna Mohan, who is a great teacher. One oncology Krishna Mohan, who was my junior in Nizam's Institute while doing MD. So which Dr. Krishna Mohan? From where are you from? Now, doctor, the patient reports that someone is putting the thoughts in the mind. मेरे दिमाग में घुस घुसा रहे. Thought insertion, thought withdrawal. ये मेरा आइडिया है, मेरा ओरिजिनल आइडिया है, इसको छीन लिया उसने. Thought withdrawal, thought broadcast. मैं जो सोच रहा हूं पूरा दुनिया को मालूम पड़ रहा है. There is a broadcast, live online streaming class. Thought broadcast. So thought insertion, thought withdrawal, thought broadcast, they're all the thought phenomena is what you need to remember. Good to see Dr. Krishna Mohan from Jharkhand, Bokaro Steel Plant. Still sitting. Very good. Very good. I'm very proud. Thanks to YouTube. आप घर में रीडिंग रूम में बैठ के एक लाइव क्लास दे दिए तो पूरा दुनिया सुन सकते. चाइना में भी बैठ के सुन सकते, अमेरिका में भी बैठ के सुन सकते. I'm so happy. And let me tell all you wonderful gentlemen and the ladies of the evening that every day evening chai pe charcha for NEET PG preparation with Dr. Murali Bharadwaz. So please don't forget to be part of this. The patient experiences that his emotions, actions, and drives are influenced by the others. What is the term for this in psychiatry? It is called made phenomena. ये मेरा इमोशन नहीं है, कोई इन्फ्लुएंस कर रहा है मुझे. ये मेरा एक्शन नहीं है, कोई बोल रहा है, ऊपर वाले बोल रहे हैं, मैं कर रहा हूं. So emotions, actions, drives influenced by others is called made phenomena. The patient repeatedly puts his hand in the hot steaming water and on asking the reason, he reports, I don't want to do it myself, but I'm being controlled by the aliens who came from Jupiter, Mars. They are manipulating my actions. I'm a robot for them and they have my remote control. What is the term for this in psychiatry? Made volition. Whenever the patient experiences that his actions are being controlled by an external agency, not by himself, इसको बोलते हैं made volition. The patient experiences that someone is changing his affect, his emotions. At times I start laughing loudly. At times I start crying. My friend in America controls my emotions. When I am in India, he can change it whenever he wants. And I am completely helpless, doctor. What is this called as? It's called made affect. Now, the patient experiences that someone is putting certain drives in his mind. He suddenly threw water on his colleague. And on asking about it, he reported there's a sudden impulse. Oh my God. the great feeling when I threw that water on this guy. And this impulse, कहां से आ रहे हैं तुझे? अरे सुप्रीम कोर्ट का जज ने बोला मुझे पानी फेंको बोल रहे हैं. So I tried resisting the impulse, doctor, but could not control it. What is the term for this? It's called made impulses. So the made impulses, made affect, made volition, they're all the part of the Schneider's first rank symptoms is what you need to remember. In schizophrenic patient, he reports hearing two or more voices which are arguing and discussing about the patient. The first voice is saying, hey, he's a strange man. He doesn't have good qualities. अच्छा आदमी नहीं है. मेरे बारे में कोई दो लोग डिस्कस कर रहे हैं बोल के मुझे सुनाई दे रहे हैं डॉक्टर. The second voice is saying, yes, also look how short he is. He's a small pygmy. So in this entire thing, the patient is listening, hearing to two voices, and the voices are using the word he, and referring the patient in third person. So what is this term for this? They are called third person auditory hallucinations, which are typically seen in schizophrenia's Schneiderian first rank symptom it is. A person who is working in bookshop heard the following voice. She has picked the Shakespeare novel. Now she is about to do the billing. Now she started to put it in the cover. ये सब सुनाई दे रहा है उनको. So in which condition do you see? These are called third party auditory hallucination. क्यों? ये auditory hallucination है, मगर running commentary के जैसे चल रहा है. And in the running commentary, patient is being referred as he. It is also a Schneiderian first rank symptom. A patient had a thought that I am going to railway station, buy 2 tickets. Immediately he hears a voice of a middle-aged woman who said, I am going to railway station and buying 2 tickets. What is this term? It is called Gedenkenlotverden, or in French it is called ecodipencies. Here the patient hears a voice which would say aloud whatever the patient is thinking. This other Schneiderian first rank symptom, 11 first rank symptoms of auditory hallucination. A patient reported that he feels intense burning sensation inside the ankle, and he says it is all because, doctor, laser rays are sent by the aliens from the Mars. What is the term for it? This is called somatic passivity. In somatic passivity, patient experiences a tactile, visceral hallucination, which he believes that it is being imposed on him by an external agent. That is called somatic passivity, which is the characteristic feature of schizophrenia. A patient of schizophrenia looked at the ceiling and immediately understood that all people in the college consider that I am going to fail in NEET PG examination. Oh my God, he's feeling. क्या देख के ऐसा feelings आ रहा है? अगर fan घूम रहा तो इसको feeling आ रहा है कि oh my God, whole world is thinking I am not going to get seat in NEET PG. इसको क्या बोलते हैं? Delusional perception. So यहाँ delusion जो है एक नॉर्मल परसेप्शन को अटैचमेंट हो गया डेल्यूशन को, इसलिए इसको बोलते हैं डेल्यूशनल परसेप्शन. सो यहां नॉर्मल फिनोमेना क्या है? फैन घूमना नॉर्मल फिनोमेना है, मगर घूमने वाले फैन को देख के अगर उसको विचार हो गया कि भाई मुझे नीट पीजी में सीट नहीं आने वाला है, दैट इज ए perception has been attached to a normal phenomena is what you need to remember. So delusional perception like this is what? It's a type of what? It is a type of primary delusion. So primary delusions are those delusions which arise directly as a result of a morbid psychological process. So basically, psychologically, the process itself is abnormal, and morbidity arising out of that is giving these delusions that are called primary delusions. The patient had a continuous auditory hallucination of a voice which said, "You will be arrested. You will be arrested." And he started believing that somebody wants to harm him. Now, this delusion of persecution is what type of delusion? भैया यहां नॉर्मली फैन घूम रहे तो एक अबनॉर्मल परसेप्शन हो गया तो प्राइमरी डेल्यूशन है, मगर यहां क्या हो रहा है? व्हाट इज हैपनिंग हियर? देयर इज अ ऑडिटरी हैलुसिनेशन ऑफ द वॉइस, बिकॉज ऑफ दैट ही इज गेटिंग एन एबनॉर्मल परसेप्शन, इसलिए it is a secondary delusion. So secondary delusions are secondary to some other psychopathological phenomena like an auditory hallucination in this case. बराबर समझ में आ गया ना? प्राइमरी delusion क्या होता है, secondary delusion is what? Okay, once more I am telling you, primary delusion means you have seen a bird flying, उसको देखते ही bird flying is a normal phenomenon, but suddenly you felt all your property is being taken away by somebody. So normal phenomenon को देख के abnormal perception हो गया तो primary delusion बोलते हैं. But auditory hallucination is provoking that police are coming, police are coming. Because of that, he has a delusion that he is going to get arrested. So this delusion is because of some other abnormal psychological phenomena. What is that? Auditory hallucination. इसको बोलते हैं secondary delusion. Now, doctor, that brings us to the end of the Chai Pe Charcha with Dr. Murali Bharadwaz. So every day, a little, we keep studying a little every day, and that little steps taken every day will increase our confidence. But before I end this session, Doc, I want to before I end this session, I want to show you that if you go to onlinembbs.com, we have released the 2022 edition of 427 hours of focused NEET PG preparation. You don't need anything else in this world except this most focused, concentrated video library containing 1500 videos. A good number of them are all short videos, so that within about 10 minutes, 8 minutes, we finish a topic. So totally medicine 39 hours, pharmacology 50 hours, obstetrics gynecology 45 hours, anatomy is 38 hours. So totally 427 hours में आपको पूरा revision हो जाएगा, right? So don't forget to give a call to our helpline 9000868356 and get a good discount to subscribe to the 427 hours of video content. So we don't simply give you a set of video library or a set of notes, but more or less every day we keep inspiring you to consume the content, to do the revision with our live online sessions on the YouTube. So good luck. And once more, we will all catch up, doctor, tomorrow at 6 p.m. Good night.